Good afternoon. Uh, Welcome to the 14th session of our International Week. My name is Rijadh, and I am accounting lecturer at the Faculty of Economic and Business, Universitas Gadjah Mada, and I'll be serving as your moderator today. You'll be hearing a lecture from Dr. Rimawan Pradiptyo on this very timely subject. But before we get started, I wanted to take a few minutes of your time to explain a brief profile from the speaker. Dr. Rimawan Pradiptyo is a prominent economic scholar and teacher. He is currently holds positions as a chair of the Department of Economics, Faculty of Economics, UGM. He obtained his Ph.D. in 2006 from the University of York, United Kingdom. Dr. Rimawan's research interests are behavioral economics, crime economics, and game theory. Now he is serving as a person in charge of SONJO, a self-organized social group in Yogyakarta, with many other important roles and positions. Now, moving along to our sessions, please welcome Dr. Rimawan Pradiptyo, who will be speaking to us on topics about working together, exploring grassroots initiative to navigate in post-COVID era.
Yeah, thank you, Mas Rijadh. Ladies and gentlemen, thank you for attending this presentation. Now, I would like to share my materials in relation to the SONJO. So this is the topic that I would like to deliver for the next 30 to 40 minutes. For the next 30 to 40 minutes. This is so. What is SONJO? So SONJO is actually the social capital that we developed during the pandemic. Different from the usual social capital that usually either physical. Now the situation is, so the way we do is the challenge is that how we form the social capital, but based on online. Now there is also, of course, there is a risk. The risk is that it is not necessarily that we know the person, who we work with personally, because we haven't met them. We haven't met them physically. But then another question is that under the circumstances, how can we form the social capital, and at the same time we will be able to deliver the program as we wish. Okay, so this is the gathering that's probably the most this is the most unusual Eid gathering. Usually Eid is the celebration after the Ramadan, and in Indonesia it's become it is like a Christmas, if you use in Europe, for instance. Many people gathering, they have friends and family, and especially in a Eid of Ramadan, end of Ramadan, or in the Eid celebration, people get together, and then based on Indonesian tradition, we asking for forgiveness. Now, this is the interesting things. Indeed, that the gathering is for the celebrating the end of Ramadan, and it's usually we asking for forgiveness for each of us. But then the problem is that we haven't met each other. This is for 2 years, more than 2 years, 3 months. We work together, but we haven't seen each other physically. So this is the first time that actually after 2 years, 3 months, and then we met, and then we introduce ourselves. We just knowing the person. Oh, this is Mr. X. Oh, this is Miss Y. That we were, in the last year or so, probably starts from the beginning of the. And this is something that is possible to do. It's probably strange, but we can use the. Actually, we can use our knowledge from game theory and also experimental economics in order to design this kind of initiative. Now, I will start. This is the topic that I would like to discuss, but I don't go deep. I just want to go, at a glance in several things that is important, and then afterward we can discuss. the matters if there is some Q&A later on. Okay, so where does SONJO start is basically the realization of the state of the nature of the state of the world. So we have the state of the world prior to the pandemic. At the moment, we are facing the post-pandemic, actually. Although at the moment in Indonesia, we have the third wave of the COVID-19. So this is we do hope that this is the last wave, and wave because of the P4 and P. We can reflect ourselves to some extent, almost end of the pandemic. Of course, this is difference. And as based on the game theory, when the nature or state of the world, when you making a decision change, accordingly, we will see that the game also change. Now, if you try to define the best response, will always change as well. So this is the situation that we encounter actually during the pandemic. So now the pandemic has changed the landscape, and the one thing that's very interesting to see the pandemic is that what the scholar said, the expert on pandemic said about it, because they said that the pandemic is the question about the pandemic is not if, but when. Now, this is very interesting to see, because if the question is so, if the question is not if, but when, then global initiative. We need to find a global solution for this. Now, because we move from one pandemic to the next, and the strategies that has been embraced by many countries, the majority of the countries are many countries conducting what I call the budget deficit. And you can see the budget deficit during the COVID, it's just enormous. And this on the left-hand side, this is the poster, which was very popular in February or March 2020. And it seems, I think this one has come from WhatsApp group somewhere in Hong Kong at that time, and it was popularized by one of the artists in Indonesia, one of the actresses in Indonesia, and she said that well, it's indeed that we are in the same storm, but we are not in the same boat. But then my question is that, is it true? If we are not in the same boat, then the question is that, well, we cannot work together. I mean, honestly, if you are in the middle of the high seas like that, and you are in a separate boat, then you cannot work together. Yeah. But then now this is the situation that what we have in Indonesia, according to the based on the COVID, there are two important things. First one is that the first phase of the doing nothing at that time. The minister of the president decided to change the minister, and afterward, start in January 2021, the policy are totally different. Start from that, the ministry of the minister of the health become the forefront of the how to tackle the pandemic, and we are the society can follow suit. Previously, it was chaos basically, because nobody knows how to do when the minister, the previous minister of health, didn't say anything about the strategy, and even he undermined the impact of the COVID itself. Okay, but then when the new minister, thanks to new minister, the president appointed the new minister, and now we rely on the now, when we our perspective or our why is it we develop, for instance, it's nothing. Nothing can be separated from the way that we perceive the COVID is. Excuse me. However, the way we've seen it, that this is a war. Yeah, this is a war against common enemy, and the common enemy is the COVID itself. The problem is that the spread of the COVID, it depends on us. The more mobile that we, if we increase our mobilization, then of course the spread of a COVID will be inevitable. So, so there are three dominant strategies that we identify here. First is that expect the unexpected, or in terms of the impact of the pandemic, but thinking innovatively or thinking the unthinkable in terms of the alternative solution. But most importantly is that the way we work is that we need to mobilize, we need to do resource mobilization in order to tackle COVID. Yeah. So how to mobilize the resources? So this is the role of the social capital. Social capital has many impact, especially in natural disasters. But then now the question is that what would happen, how can we use the social capital in order to minimize the adverse impact of the COVID-19? Bear in mind that this is not the common practice that we usually do during the disaster. In natural disaster, from time our social people giving, helping each other, and etc. But then the challenge is that during COVID, we cannot help them physically. Why? Because our mobilization is also being limited. So this is the question: how do we how we can form the social capital, but we cannot work physically? Yeah. So this is the situation. If the poster that has been posted in March, popular in March or February or March 2020. But the way I've seen is that, well, hang on, we have the way, the traditional way of working together. It's called sambatan. So sambatan is actually social capital in developing for developing a house. So in the old days, when people trying to develop a house, then what they need to do is to prepare for the materials, and then they're asking their neighbor to help them to develop the house, and then their neighbor will work 2 to 3 days full time. All of the so what I if I'm the host, then I will prepare the food and snack and cigarette and coffee and tea and etc. Yeah, during those 2 days, and all of the materials, and by the time it's finished, voila, my house finished. I can develop the house, and then this can be like to do that for next month. Then I will volunteer to help them as well. So this is the idea of the sambatan itself. Okay, but then how we do it with the internet. Okay, now the question is that how to mobilize the resources. The problem with us is that our challenge is that our government doesn't have sufficient funding. We are not developed countries. In developed countries, you have many resources actually, and then probably don't have any problem with creating that's a budget deficit about more than 6%. But for us, the maximum that the government can afford is just only 6%, and it should be taken into consideration in terms of the structure of Indonesian economy. Is that SME, or the majority of our SMEs are in informal sector, and the economy has been 60% of the economy is basically occupied by small medium enterprise. Okay, so this is the challenge there. So how we cannot only rely on the government budget, because the government budget is very limited. Okay. What we need to do, the government, the GDP, one GDP. So 5% of the GDP belongs to. So if you are in the war, logistics, the logistics, not in, but in the we move to approach rather than the government. Okay, so this is the situation. The government doesn't have sufficient money, sufficient resources, so we need to approach the society in order to get access of the resources. And we should take into consideration that the resources, what we mean in here, is not necessarily about money. Money is part of the resources, but the majority of resources is actually not about money. Okay, so your willingness to help is also resources. The time that you spend to help each other is also resources. So this is the situation that we try to tackle. So that's why we have a Sambatan Jogja. SONJO is a Sambatan Jogja. So the way we see it like this, what would happen, based on the survey, Indonesian people using 3.5 hours a day to access social media. It's a lot. Yeah, we love social media, and we love playing Gadjah anyhow. Yeah, that's in Indonesia. The idea is that what would happen if I take, if I ask everybody to donate a half of hours out of 3.5 hours that they spend for the social media to help each other, participating in SONJO. That's the idea. So in here, we don't have SONJO. Okay, so that's 2 years, more than 2 years, 3 months. Do we have any money? No. Do we generate funding? Yes. But we don't accept any money, and because we don't have any account or anything. So if we're trying to generate funding, it's actually the fundraising. It goes directly from the donator to those who are accepting the help. Yeah, and that includes the vaccination. That includes the isolated patient who do the self-isolation, and that includes as well the PPE, personal protective equipment, medication, and things like that. And the way we do it, trying to facilitate this is some sort of like a bank, basically, like intermediary, but we don't take any fee or interest rate or anything. Yeah, so that's always free. So what is the mission? The mission here is how to help vulnerable people and people at risk during the pandemic COVID-19 in Yogyakarta. And the values is that there are 4 values that we promote. Is about the integrity, transparency, empathy, and the synergy. Yeah, so this is we don't need the funding. And what is our key performance outcome is about the outcome, and this is totally different from the government. The bureaucrats has the KPI. Their KPI is budget absorption. So this is some sort of like a sarcastic approach to tell to the bureaucrats that actually, even without any funding, we can achieve various outcomes. Then the question is that, why is it that you have lots of money, but you don't, and where is the outcome that you achieve? Now, this is the question that we from time to time we ask. Now, this is the distribution of the team WhatsApp group. Now, this is based on the WhatsApp group. The question is that, why is it that WhatsApp group? It's simple. Because in Indonesia, people are so fond of WhatsApp. It's easier for contacting people in WhatsApp rather than email people. Even many expatriates, after they work in Indonesia, they change from email to WhatsApp. You contacted me via email. This rarely I check my email. Yeah, of course, every day I check my email, but not as frequent as my WhatsApp. Yeah, but you contacted me via WhatsApp, I will reply instantly. So this is something that common in Indonesia. That's why we use the media that is popular among people. So we don't create complexity in the circumstances. So, and if we relate between the epi curve and the SONJO activities, so these are the what is that, the illustration from this graph. So you can see during the peak, during the first wave and second wave, you can see the more wave that we get, and then more and more groups that has been developed. And then this WhatsApp group is based on the program. And the program is based on our needs, or the society needs. Okay, so this is the way how it works in SONJO. So how can people solve the problem simply by using WhatsApp? Okay, let's take like this. If we gather 50 of us gather in one WhatsApp group, and then we face the same problem, which is the pandemic. And then let me discuss freely. What would happen? In the first place, people will, in the first instant, people will moaning and people are complaining about their life, the problem that they encounter, and they start talking about, okay, I have this kind of problem, that kind of problem, and etc. Okay, let people throw them up, everything what they have, the problem that they have. That's fine. Every night, what I did is just making minute of meeting. Yeah, at 23 11:30 in the evening. At night, usually I make a minute of meeting summarizing the discussion within the WhatsApp group and see to identify what is the challenge and what is the problem that we have in the first week. And if there is identified as a challenge, then I will put a red font. The first week is just full of red font. Everybody just throwing their problem. But the second week, it's different. Some people start asking questions. Okay, what can I help? What I can do for other people? So in these circumstances, I will give them green. Yeah, the font is green. So the second week, the minute of meeting changed slightly. It's getting greener, and greener. But in the third week, it's become blue. What is blue? When people say, okay, I have this problem. I think, I see like this. I saw this problem and I can help you. Can I contact you outside of the WhatsApp group? That's it. For me, the problem solved. That's become blue. So this is the way so basically this is the demand and supply of help within the WhatsApp group itself. Let's the market play. So what you need to do is just to give the direction, inform people that this is the problem that we have, and we identify the development of the problem and how to solve the problem timely to them. And then people will see the difference. And then once they found out that WhatsApp group can solve the problem, that's it. Yeah, it will grow so easily. In the first 3 weeks, we developed from 1 WhatsApp group to 7 WhatsApp group. Okay, and then it's developed since. Okay, so this is we have like learning curve, of course. Yeah, later on I will show you. So what is the program in economy? So we concentrating in economy and health. Why? Because this is the most problematic situation that we have, and it's just based on the needs of our members. So here we have 8 programs. Yeah, it's ranging from the database. We have we trying to promote the culinary product, for instance, and even we have the showcase apps. We developed the showcase app. About 400 SMEs is registered in there. You can install it if you wish. You just copy the icon, and then afterward you can see what kind of food and what kind of product that they sell. What do they sell in there? It's many things, but from food and beverage up until clothing, fashion and things like that. Everybody just selling in there. So there's about 400 SMEs, and then we give us the some kind of a room for them to showcase their product. And then if people are interested, and then they just contact the seller by WhatsApp, and then the transaction is done in there. So there is no transaction within the case app itself. Why? Because if we maintain the transaction in there, of course that will incur costs, and the cost money is something that we don't have. Okay, so we only give some sort of like the apps, which is one step underneath the like a Tokopedia, or what is that? You can like Amazon or anything. Just only one step down there. The idea is that to give the opportunity of the SMEs, which previously they do have a smart mobile phone, but the mobile phone will only be used for WhatsApp and SMS and call. More than that, no. So during this circumstance, during this situation, we introduce to them how to develop the poster using Canva, for instance, training, and how to make a photograph of the product, and how to show the product to the people and marketing and things like that. And we introduce to all of the members in SONJO. Okay, and then we have also the Hamper Festival here, because from time to time, during 2 years, of course, we went from celebration of Eid, and to celebration of Christmas, and also Buddhist or Hindu holiday. So we're trying to promote during that period, some sales in there, promoting so many things. And also we have in the export, so several friends like Pak Denny, who's in the coffee, and also the tempeh, the tempeh is joining here as well. So we have the passatis and also the catering. So this is the program in economy, and the way we do is trying to how to mobilize the economy, how to move the economy by using the digital transformation. And the digital transformation here, don't even think like Amazon, which is very elaborate and very sophisticated. No, we start from the WhatsApp, because again, in the WhatsApp group, there is a demand, but remember, there is also supply. Okay, so we can solve in there. And if we have a 30 WhatsApp group, one product that has been introduced, we can spread to other 29 other WhatsApp, and then the demand, of course, will increase because of that. Okay, so I want to go straight into the health. We will discuss later on about the. Hang on. Now, what about in health? So this is the program that we have. Okay, so 13 program in health that we introduce and we do. It's starting from creating the poster, and then we helping the PPE, hand sanitizer, and things like that. And also we even have the promoting the innovation. One of the product that we promote at that time is the equipment to identify the COVID using breath, and that's made by a colleague from Faculty of Science. Also, we have at that time we do have convalescent, yeah, and also we have even we created this one data SONJO database Rewangan. This is for the referral system that we created because we help the hospital in Yogyakarta to help them to refer one patient to another hospital. So one hospital to another hospital, especially for the COVID. Yeah, and we work with that. So I think it's lastly about 150 patients underwent this system. So this system helped the official system that has been developed by the government, but it's the way they develop it was too complex, because the way they developed their referral system it was based on prior to the COVID, and when during the COVID they're adding more procedure, and I said no, you cannot do that. So because many people, the director of the hospital asked for help, and then he asked me, is it possible that we can we develop a new WhatsApp group to help each other, especially among the hospital management? And I said, okay, let's do. And then afterward, they tell me about the problem of the referral system that has been developed by the government, and I proposed to them, okay, I will create the new system, which is based on the double auction, and we use it with the Excel and the WhatsApp and it's work. Yeah. Also, we have Sonjo Husodo Tangguh here. We created a shelter. So let me show you. Okay, so this is the Rewangan that we have. This is the database for the Rewangan that we've done, and this is the shelter. So the shelter, don't expect, again, this is because of in developed countries. Mas Riri, probably I need 5 more minutes, yeah, before we.
Yeah, sure.
So,
yeah, sure.
If we're trying to solve everything in a hospital, it's not sufficient. So here, there is one innovation from Bantul Residency by doctor. It's called Dr. Glory, and Dr. Glory also joined to SONJO, and he explained to us about the shelter. So the idea of shelter is how to separate the asymptomatic patient and the patient who are ill, and the society who are not infected, because this is very important, because many people is actually asymptomatic. But if you let the asymptomatic at large, then of course the spread will be inevitable, and the problem will be what would happen to the people who has a comorbid and elderly. So that's why here we develop what I call the sub-village shelter, and then regency shelter, yeah, and then goes to the hospital. And this is probably something that's different, because the referral system in healthcare, it should be goes from lower to higher, but here we do it in 2 ways. So if your situation is worsened, so if you start from the village shelter, supposedly that you are asymptomatic, you go to the village shelter, you live, you stay in there, and then you eat and you do all sitting in there, and then you start to develop a symptom. So what would happen? We will send you, excuse me, to regency shelter, because this is for the mild symptom. If your situation is worse, then we will refer you to the hospital. Now, on the other hand, if you are a patient in a hospital and your situation is better, so you will be referred down to the village shelter. In these circumstances, we can ensure that that the hospital will only taking care of the medium and high and severe symptom, actually. So this helped a lot, during the pandemic. And this is and then we develop in Bantul. We start working in Bantul, and then afterward we created some sort of a training. And this is the achievement that we got. In the end, we have, I think, this 8-time training, and these are the shelter that managed to be developed. And we work with other communities in Bogor, Jakarta, Kudus, Pati, Jepara, and including in Madura. Yeah. So, and there are many forms of the shelter itself. Okay. This one is the SONJO Shelter Tangguh. This is based on, this is a charity. Now we have this is the life passion and music. This is this professor. He's our professor in medicine, and he was the first victim of the doctor in Yogyakarta who got ill because of COVID, and then he passed away. His wife is also the professor in Faculty of Medicine. She's expert in playing piano, and she has a concert. Now, the second concert, all of a sudden she dropped me WhatsApp and saying that, Rimawan, I would like to donate the result of the live passion and music to SONJO. And I was shocked at that time because I never thought that people do that. And then what should we, and then we trying to allocate, okay, what can we do? We're trying to allocate the resources that we, the donation. We have a 50 shelter in Bantul, Sleman, and Kudus, 71 volunteers group, 16 hospital public health, and 783 patients who did isolation in Bantul, Sleman, Kudus, and Yogyakarta. So every single patient, they stay for 10 days, and we cover their meal, basically, using this funding. Another, this is the worst experience that we have during the second wave. There are many people died at that time, and the coffin is not sufficient. The body bag is not sufficient. All of a sudden, one of my friend contacted me, said that we are using our skill and tools to produce coffin and to donate to the hospital, poor people, and volunteer. And it is free of charge. Every day, they manage to produce 40 coffins per day. In total, 600 coffin has been delivered. This one by Yogyakarta Royong, 672 coffin, and then Sambatan Kayu Jawa, 100 coffin. Bravo 5 DE is 48 coffin, including free body bag, 320 body bags. Yeah, and then we have the vaccination, and the vaccination is doing until now. It's working until now. So this is the adaptation, yeah, to the local needs. Our colleague from Loro Plonio, they underwent, they conducted. They conducted vaccination in the evening. Why? Because majority of people who they serve, which is in Gunung Kidul, the Gunung Kidul is southern part of Yogyakarta, and apparently in there, when we did in the first place, it was quite distressing, really, because we invite 500 people, but then only 100 people turned up. And then our colleague from Loro Plonio has a discussion with the people. Apparently, majority of them, at first, people said, oh, they refuse to be vaccinated. Apparently not. The problem with them is that the majority of them work in other municipalities, work in other cities, and they will return back in the evening. So most of the shop in Yogyakarta shut, they will close at 21 hours. So 2100. So in that circumstances, and then they start to go back. So taking about an hour and a half to reach that home. So this vaccination has been, they've done the vaccination start from the evening. And then they managed, 1,000 invitation, 3,000 people turned up. So this is a big success. And of course, and then we understand that we need to adapt into the needs of the people. Yeah. So this is the situation. So we have what they call the crowdfunding of the vaccination, and this one is called Vaksinasi Cimpitan. And this one, even the Minister of Health acknowledged that our vaccination is the most efficient in Indonesia, which is 6 million rupiah per 1,000 patient. Yeah. Okay. So this is. So you can see this. So the total, how much the total vaccination that we have no, this is the data on March actually. So at the moment, this number has become 450,000. Yeah, and this one is about 200, more than 220,000 doses that we deliver. To the society. Okay, so what is the lesson learned? So this is the way that we're preparing for the next pandemic. Yeah, we need to think about the how we prepare for the next pandemic, and the social capital may be used as one of the strategy to tackle a problem, especially in developing countries like Indonesia. So another thing that we need to think of is about the narratives that the government should give. Since we are independent, usually the narratives that we have, that the government has is always be positive. Never thought about sense of crisis. Never talking about the scarcity. But I think this is the one that we need to address the most. And secondly, is about the trust. So because of the trust, anything can happen. Anything can be done because of the trust. And the second is about the sustainability of the social capital. And the way the sustainability here, we don't use the altruistic approach. That what we use is the fairness. So we don't use the altruistic approach, but the fairness. So in a way that we are helping those who are willing to help themselves. If they don't want to help themselves, forget it. We don't need to help them because they don't care about themselves. Yeah. So we only help those who are willing to help themselves. So this is the idea. This is what I call the fairness equilibrium. Okay. So I just want to close this one. Yeah. So this is basically. So what is the lesson learned here? So we move from business as usual. Yeah, to something what we call in Indonesia, we call mau. Mau is eagerness or the willingness. So this has come from the discussion within SONJO. There are so many things that we've done. And that's because we are willing to do that. It's nothing to do with whether we have money or not. Nothing to do with that. It's just only one thing, whether we want it or not. Okay, so that's why usually we talk among our friend in SONJO is that it depends on one aim. What is that? Mau or eagerness or willingness. Once we willing to do something, everything can be done. So thank you, folks, and then we can have a discussion. Thank you.
Thank you very much, Dr. Rimawan. Now it's time for you to have a chance to ask questions or maybe give a comment on Dr. Rimawan presentations. I will give you a chance for you. You can ask directly or you can write it down in the chat box. So please raise your hand for a participant who wants to ask the questions. Okay, we have one question from Owen Auditorium.
Yes.
Please.
Okay, so thank you for the lecture, Mr. Rimawan. So I have just one question. So to what extent can this social initiative replace the role of government in COVID-19 Relief Act? Thank you.
We work side by side, actually, with the government. Now, the question is that which government do you mean? Is it because in Indonesia we have the central government, and also we have the local government. Now, unfortunately, it's the situation is not as good as what we expect. If we are in Jakarta, then probably we don't have SONJO. Why? Because the local government is excellent. They work very hard. And if, for instance, they do the test, the daily test, they do it quite a lot. They even 25 times than the recommendation of WHO. It's different from Jogja. So based on the realization that, what can we expect? If the government is quite, the local government is quite passive, there is nothing we can do except trying to work each other, trying to work trying to help together. But then we still open to collaborate with them. Why? Because regardless how active the government, but still they are the government. They have resources that more than we do. So if we can help them and they're willing to be active as well, so that's a good plus. But if they are not active enough, that's fine. We still do it. The most important thing is that our responsibility, this is our responsibility to humanity. We don't care. I don't care whether the government working or not. It's not my business. My business is that our business is that how can we help? Because out there, they are our family. They are our brotherhood in humanity. So that's our responsibility. If we can help them, I think it's trying to minimize their burden. Then to some extent, it's also help us as well, right? So this is the social responsibility that I think that we need to spread across. That we don't need to see whether the government active or not. I don't care with that. The most important thing is I work. And the most important thing is every day we try to help our brothers and sisters, regardless of their race, regardless of their skin, regardless of their religion. It doesn't matter. The most important thing is they are human, and then we help. Even now, we're not only helping a human, but we are helping because we have a PMK. What is that? PMK in English. This is the disease of the like a cow, that's attacking the cow. And this is a virus, like COVID, but that's to cow. And now we have that as well. So we also help animals, cattle in these circumstances. Okay. Any more?
Thank you.
Yeah, we have one question from Nicholas Gustin. Yeah, please, you can ask directly to Dr. Rimawan.
Okay. Hi. I have a question. I'm just a bit curious here. You mentioned that there's no fees whatsoever related to SONJO, and looking at the scale of like what the services you provide, like the data, the way that you connect other people with other people, and this is a very large scale because like it's not just like a one-person team. This is like you have like 40 WA groups and just like everybody in them. Obviously, there's going to be a bit of costs incurred in like some of the activities which are carried out. Are these platforms kind of like completely non-profit, or are there like methods in which you gain the required funds in order to keep these processes running to your expectations?
Yes, basically we are non-profit, and because we are basically this is the social movement. So we are not institution. And based on Indonesian law, we are not allowed to accept any funding. Do we have funding? No. Do we generate funding? Yes. But how to do that? That the funding cannot goes to us, but it goes directly to the benefactor, is by dealing, trying to put everything in the WhatsApp group. So for instance, like vaccination, we worked together, and then we found out that for 1,000 patient, you only need 6 million. Okay, so what is the 6 million for? So basically, this one is for snack and lunch and then you hire, you rent a tent or a chair and that kind of stuff. Yeah. Why? Because the government only cover three things. One is this is the one that's free, is three things. One is the vaccine itself, it's free. And then the injection, the method for the injection, yeah, the injection equipment, and lastly is an alcohol swab, and that's it. That's it. But then the question is that if you want to do mass vaccination for 1,000 or 2,000 people, what would you do? Is it sufficient? No. Of course, we need to rent premises and etc., including if you talk about 1,000 people, then the operation may be start from 8 o'clock until 1 o'clock, 2 o'clock in the afternoon. So you need to have some sort of like snack and eating and things like that, and also the PPE and etc. This is the one that we cover, but nobody take the advantages of this. Okay, so where's the funding come from? We open the donation using auction. So the auction is that, okay, this is the cost of this particular mass vaccination. Who would like to contribute? There are many, apparently that there are many corporations are willing to donate. Why? Because we are very efficient. So where's the money goes? Yeah, you don't need to transfer to me. Okay, by the time so imagine that you want to have you put the proposal to us that you want to do the mass vaccination. We upload it in one. We have two WhatsApp group for that. It's called SONJO Srikandi 1 and Srikandi 2. Why is it that's two? Because it's not sufficient. The members is more than 256. So we have to open a two WhatsApp group. And then we try to promote. This is the proposal. So this is the amount of money that we need. This is the target of the injection. How many? So how much? Who will support? Who will participate? And then people said, okay, I will. We need 6 million. One of them said, okay, I can give you 1 million. Okay, I can give you 500 rupees. Okay, I can give you 300,000 rupees. That's it. And sometimes this kind of process can last only for our record is 6 minutes. During 6 minutes, it's gone. Okay. Another question is that there is some company, they come to us, but we would like to help you. Okay, in what way? Okay, about the vaccination. Okay, that's fine. Can we pay everything? He said, no, you cannot do that. You cannot monopolize the donation. How come? He said, well, come on. If you monopolize the donation, what about other company? What about other people? People in SONJO is also willing to donate. And I said to them, don't try to monopolize the heaven. If you want to go to heaven, don't try to monopolize in such a way that other people cannot go to heaven. Other people are willing to go to heaven as well. So we make the rule that the maximum donation is only the maximum is 1/3 of the proposed budget. If the proposed budget is 6 million, the maximum that they can give only 1/3. Okay, and once the auction finish, and then we can say, okay, this one is finished. This is the number of the PIC. This is the number of the account of the PIC. So let's transfer to them and then copy to us, because we need to monitor that. 2 weeks after, and then during the vaccination, the PIC will send. So all of the PIC is in the WhatsApp group. So all of the PIC will send the photograph of and sometimes videos of the application of the implementation of the vaccination, and then afterward. 2 weeks afterward, we ask them to give the formal report. So we have everything. Do we need to do? Do we need to go to the village? No, I don't need to go to the village. I just stay at home. What else do you need? If you need ambulance, okay, that's fine. How many ambulance do you need? one of the occasion, the Bulura asking, Pa, will it be possible to gather 15 ambulance? Okay, that's fine, boo. And then we have another WhatsApp group. It's called SONJO Transport. This is the gathering of many ambulance, and everything is free. And then I said, okay, and this time, and then we give in a WhatsApp, excuse me, ladies and gentlemen, next week and in this time, we need 15 ambulance to help elderly to one place to the next place, and for the vaccination. And how many turned up? 17 ambulance. Do I have to pay? No, free. So, Mas, what do we need? Do we need money? No. What we need is the willingness. 1M. Mau. Am I answered the question? Please. If there is more question. Yeah.
That's fantastic answer. Thank you, sir.
Thank you. Any more?
Right.
Please.
So we have a comment from John in chat box. It is great to see Indonesia adapted to utilize local solution to manage the pandemic suitable for its context instead of following a top-down one-size-fits-all solutions. So that's his comment. And then the question is, from the observation, can we deduce the most developing countries, unlike the developed ones, were quick in managing the pandemic at a community level to the fact that we have faced prior crashes? How can we utilize this experience to spur our recovery?
Oh, yes, thank you. Now, actually, we do this because our government, of course, the capacity of our government is different from developed countries. Yeah, in developed countries, everything has been, the tax and the subsidy everything is worked very well. So no wonder if the role of the government in developed countries is usually huge. Take a look at our neighbor, like in Singapore. Of course, in Singapore, it's not so many. You don't expect you meet something like SONJO like this. We do have SONJO like this because we know the situation is that if we don't work ourselves, if we don't help ourselves, nobody will help us. And even the government has a very limited funding. They have limited resources. So what we do is this is a matter of survival. And how about how to utilize for the recovery? Then this is what we trying to do, especially in the economy. To get, trying to move the economy. There were many cases that somebody WhatsApp, and they said, okay, I have a friend, somebody this is relation, excuse me, this is what I call Sanjo Pangan. So this is for the SMEs. Somebody wrote in a WhatsApp group like this. Will it be possible if my friend joined to this WhatsApp group? He has a problem. And then we said, okay, what is the problem? He's a farmer, and his crop is aubergine. Now he harvested aubergine, but he doesn't know how to sell the aubergine because the market is closed. Okay, and then I said, okay, let's invite the person. The person has been invited, and then I asked two things. Pa, would you like to send the photograph of your aubergine? And then on top of that, please add your WhatsApp numbers. Okay, and then he gave it to us the photograph of the aubergine because he have a pile of aubergine like that. It's like a mountain, yeah. And then he already add his WhatsApp number. And then all we can do is that spread to all of that picture. We just forward it to other WhatsApp in SONJO. And then we said, please help our colleague because he harvested the aubergine, but the market closed, so he doesn't know how to sell the aubergine. I tell you what, in 3 days, the aubergine gone. The aubergine gone. Because everybody buy the aubergine. The same case occur for something else, including fish, including chili, and etc. That's as simple as that. We even help the butcher. Yeah, this butcher, she mentioned to us prior to the COVID, her sales is about 1 ton per week. 1 ton per week. And usually she supply the hotel and the big restaurant, so they don't care about what is that, the retail. So all of the chunk is a big chunk, 100 kilos, 200 kilos, and etc. During the pandemic, how much the maximum sales? It's just only 20 kilos. 20 kilos a week, 20 or 40 kilos a week. She has 5 employees, and she cannot bear to, but she cannot fire them. And then she joined us. And then I said to her, at that time we have a short video on how to create a poster using Canva. And all of a sudden, people are working together, and they're trying to learn on how to use Canva. And then we said, okay, if you cannot do it yourself, you maybe ask your kids, or you maybe ask your nephews to develop the poster, and then afterward post it to us. Once they post it to us, and then we spread across the what is that, in SONJO WhatsApp. And then all of a sudden, the lady said, well, thank you. 2 weeks ago, my sales increased from 20 to 60, and then increased to 240, and then the third week to 350 kilos. And then that was approaching the Ramadan. And she said, thank you, because of SONJO, we can pay the THR. THR is a bonus, the bonus prior to the end of the Ramadan. And she said, now I can pay the bonuses for 5 of my employees. And using what? As simple as WhatsApp group. Any more?
Yes, we have question. I think the next one is from Alfif, and then Bramantio, Jovan, and Almara. Alfif, I think you can ask questions to Dr. Rimawan.
So thank you for the opportunity. Maybe as you mentioned before, sir, the SONJO is an informal organization. Maybe I'd like to ask regarding the organizational structure. Is there any committee or audit committee, or maybe board of commissioners to prevent free riders or also misinformation, sir, that the members have? Thank you.
Yeah, thank you. We have what they call, we only have, because, well, basically, this is self-managed, yeah. So basically, we don't have a commissioner or anything. We have a ethical committee. So the ethical committee, their work is basically to prevent the potential of a moral hazard. Yeah. For instance, in one circumstances is that, and we always consult to them if things, to prevent us from any wrongdoing. For instance, when we work with the, let me show you this. Hang on. Hang on a sec. Bear with me for a second. Thank you for asking the question. Now, this is what the referral system that we develop, yeah, to help the hospital, okay. But then there is a challenge in there. Why? Because we need to identify who is the patient. But then we're not allowed to identify the identity of the patient shouldn't be revealed in there. So the way the referral system works as follows. A particular hospital will raise the issue. Oh, I have 3 patients that I would like to refer to other hospital. Of course, they will they will identify what kind of illness do they have, yeah, or the symptom. Well, the symptom, when they wrote it, I don't have any clue. I don't have any clue what is that, because I'm an economist. But the most important thing is that we are not allowed to give identity of the individual. If we're only talking about the age, gender, that's fine, but not the name or etc. Now, in order to develop this kind of a method, we consult with the ethical committee until they said, okay, this now the referral system is safe and will avoid us from the ITE Act. Yeah, what is that? IT, what is that? Freedom of Information Act, and etc. So this is the situation that we do, and it's worked. Secondly, another case is that when people doing a charity or something, and then when they're trying to get, for instance, they would like to send some institution. We give them money to, or there is some charity to give a funding or anything, to, and the account is not based on the institution, but based on individual, and then we consult to the ethical committee, and usually the answer is no. Why? Because if the account is an individual account, we cannot take any responsibility. It's too dangerous. So you have to. We can say, would you like to change? Do you have any institution that you can use to receive the funding? Yeah, because in this way, that will be much easier for us to identify. So this is the way to minimize the risk. Okay. Is that answering your question?
Yes, it does. Thank you, sir.
Okay. Any more, please?
Okay, Bramantio, now it's your turn.
Okay. And is my voice clear?
Yeah, please.
Okay. So I think we are familiar with Spanish flu. So compared to how the Western or European countries deal with Spanish flu with their limited resources, do you think we handle current pandemic in a better manner or worse? Thank you.
Oh, I think now I think it's in comparison. I think relatively we handle the COVID pandemic much better. Yeah. If we still, well, thanks to president who appointed the new Ministry of Health, yeah, because he worked very good and we work very strategically, and without his leadership, it is not easy for us to reach until this case. Yeah, I do apologize that I am not being able to attend this presentation live. Yeah, in FEB, because I have to. I just got the COVID, and I was hospitalized for 5 days, and now is in the next 2 days I will be. I'm in isolation, and so it's just quite very unfortunate. So, but thanks God that I got COVID in the last stage, because I already got what is that, booster, and the Omicron is much much weaker than previously. Then again, that's why is it that this is, I think it's Indonesia achieving very good achievement in terms of this, and part of the equation is actually because the central government give us room to work, to participate. Like from time to time, Ministry of Health, the Minister of Health also talking about how fast actually the vaccination in Indonesia, because they open the possibility that society like us to participate, and that speed up the process. Thank you. Any more?
Yes, now Jovan.
Yes, hello, Mr. Rimawan. If I
Yes.
may, I have two questions. The first question is actually you a little bit already answered it, so I will change the question, but in the same topic. So basically, I really appreciate most of the researcher when they do something. For example, they do it something from based on their conscience, not from other matter like profit or something. So my first question is that a company, as we know that they always basically the purpose of a company is to make a profit. So sometimes they do a good things, but there is other things to do. So I try to look at the Sonjo, sir. I think the idea of Sonjo is really good, and I just see that the Excel of the Sonjo, sir. So I think so. This database is basically for me personally, just for looking at very brief. It's a really important, and I think most of the many company is really want to have this kind of database, sir. So I think my first question is that sometimes there is what we call lesser evil, sir. For example, like that. But what I mean by lesser evil is that I know that previously you said that there are some company that already like contacting Sonjo and they want to give a donation. So my question uh, is there any possibility or is there any disadvantage that a company, for example, that are used in the e-commerce or something like a Gojek, collaborate not so basically there are no money involved, but use the database to collaborate in a greater meaning. For example, what I see here in the Excel, most of the method pembayaran or the buying methods, maybe some of them is used Gojek or something like that. So maybe if a Gojek could use the database, they could make a sometimes it's of the Jogja for only Jogja. So they could like make a section in their app, for example, helping a MSME like that by using the database like that. So do you think is it necessary to do a like a collaboration with the company? Because I think sometimes the benefit of collaborating with a company in this context, it can increase the efficiency of the use of the Sonjo, sir. I think that's my concern.
Thank you. So far, no company asking for that. Unfortunately, yeah, because our data is also limited as well. Actually, I mean, when we do have, in the first 3 weeks, we trying to identify. Let's call Sonjo database, and we identify the demand and supply of the food. Yeah, why we do that? Because during the lockdown, of course, the supply of the food in the market goes down. So at that time, we need to identify, and people are so confused, how to get this kind of food and how to buy this kind of food and things like that. So we created the database pangan. So at that time, we identify all of the shop and even the supermarket and the market that's still open, and the owner, and people can contact the owner, and then they can order. But then that's I think it's just about 2,000 SMEs that we have in there. Yeah, it's not that big deal. Unfortunately, probably this kind of stuff is in terms of the scale is not that big. So far, we haven't received any offer for this kind of collaboration. What the offer that we usually from time to time have received is that they have a CSR. The company has a CSR, and then the company would like to help us for the donation for the PPE, either for the PPE, for the shelter, and even for the vaccination. Now, if this is the case, then for the vaccination, for instance, then we have the rule that the maximum is only 1/3 of the budget required. Yeah, and obviously we have the backdrop, and in the backdrop, of course, there are several logos, and you cannot have the logo for yourself. So you have to share the logos with other companies. Many of them, they said, well, we don't mind with that, and we trust you, and so you allocate as you wish, for instance. Yeah. So this is the situation that we have, and for that kind of approach, then we thank them, and also we give them a report how we spend how the allocation of the funding has been done. So everything is in, the good corporate governance. We always concerned about the good corporate governance and also the transparency of the movement, because that is the what is that? The holy grail for us, because the trust is the most important thing. Once the trust can be developed, that's it. There are so many things that you can do because of the trust. Okay.
Okay, sir, I'm sorry. So my second question is related to the first answer that you answered previously, basically. So as we know that, I know that there is a disadvantage in terms of the SONJO, maybe in terms of database like that. I think from what I just roughly observe, do you make some kind of survey that this program is basically helping people in the program of the project that giving up food or something? Because my concern is that, for example, for me, sir, if I am someone who wants to buy a food and then I go to the Excel and I want to contact them, in my mind I'm a little bit afraid, does these people will rob me or something, or they will actually rob my house? I think I'm a little bit afraid to contact them, sir. I think even in Gojek, sometimes we found not a really appropriate person in the Gojek. So I think that's my question, sir. And I'm sorry, I'm sorry, sir. Maybe it's kind of related. Just one more thing, in terms of the WhatsApp, I see that WhatsApp is a little bit confusing for me, especially in the organization matter. For example, there are so many texts. It's kind of like seeing something like a wave of information. And since that this is a non-profit organization, and most of the time the people is not really have a kind of like obligation, how do you make sure that the program is always been in selalu jalan? I'm sorry, sir, in terms of bahasa Inggris.
Yeah. So how to make sure that that works? Yeah, basically. Now it's simple actually. One thing, first one about the survey, and we trying to ensure that, of course, we don't think in that way. Yeah, we're not talking in the we need to identify whether the person is a good person or not. No, we start from, if you want to promote trust, then you have to start by trusting your colleague. You have to trust people. The way you do, the way you suggested, it means that you never trust people. If you never trust people, how can you promote the trust to open this what is that social capital? If you never trust the people, you cannot ask other people to work with you. So the first thing that we do is that we always said, look, this is that we are in a unfortunate situation. Everybody suffer. Let's help each other. And in order to do so, we trust you. And please trust us, and also help to be and make yourself to be trusted. That's the only thing. Do we need to survey them? I think that we're just wasting my time. If it's just wasting our time. Why? Because the most important thing for us is to ensure that the program works. Yeah. Because if there is any dispute, the dispute will be solved by those who order, not by us. Yeah. Is there any dispute? Yes, but then they solve it by themselves, because everybody joined in a group, and then they said, "Hey, I ordered like this, but then you haven't replied." They talk in a WhatsApp, and then we can say, "Okay, let's solve it. Try to solve it by yourself. You need to trust your friend, and you should be trusted, because this is the only way that we help ourselves. If you ruin that means that you don't want to be helped." Okay, and that's it. It's simple. It's simple. Okay, so get rid of the that if you don't trust people, then that's it. This kind of initiative do not work. Secondly, regarding, what is the second question?
Sorry, sir. The second question regarding the how do you manage the internal organization in terms
Oh
of
yes,
efficiency, sir?
yeah. It's of course we have several people who work together with us. So several people that can be we divided our works, yeah, and those people are committed, and of course that we can see them based on the discussion within the WhatsApp group. Then you can see the several champion, yeah, and those people usually will lead. So we give them the opportunity as well to lead. So that's why this is for us. The idea is that this is for us. It's nothing to do with anything else. This is for us. So so the division of labor will be easy as well to be done. It's no problem with that. Back again, if you want to make the what is that, the social capital works, then the first foundation is that trust. Remember, we have 2,300 people in the WhatsApp group, in 30 WhatsApp group.
Thank you very much, sir. It's really answer my question, sir. Thank you.
Okay, thank you.
All right.
Yeah.
Any more questions, please?
The lady, I think the lady, who's the lady who
Yeah, we got one. Mada, I think. Do you still have a question for Dr. Rimawan?
please?
Yeah, actually, one of my question has already answered when Jovan asked the question. But just to make it short, because it's almost over time, I wonder if there will be other developed sectors after the world is more stable, probably in the sector of education or women empowerment, maybe, because I find this this movement is very inspirational and useful. So do you think you will expand the movement into other sectors, sir? Thank you.
I don't know, to be honest, because the idea, the aim of SONJO is how to help ourselves during the pandemic. What would happen if the pandemic ends? If the pandemic ends, I don't have any problem if we get, we get rid of SONJO. It's fine, yeah. Or we continue with something else, that's fine either. So it's up to our colleague in SONJO, how we determine our future. But to be honest with you, I mean, the idea of SONJO is trying to create some kind of a rafting. So this is some sort of like a boat. This is for the secure boat, basically. By the time we use it, now we use it, and if we don't need it anymore, then that's fine. We can get rid of it, and then we back to our daily routine, basically, prior to the pandemic. So I haven't have any envisage about what would happen with the SONJO in the future. Well, I mean, so long as SONJO has already delivered its purposes, and that's it. Yeah. And what would happen if we get rid of SONJO and then there is another pandemic? It's easy, creating again another one. As simple as that. Okay.
Is there any questions, please? From the audience, still have one more question, I think. One more brief questions. Yeah, actually, there is a comment from John in the chat box telling that the similar community level approach also be utilized in Kenya and also in India. Yeah, so the similar approach like a SONJO is also happening in a different country. That's coming from John. Yeah.
Oh, thank you, John. That's good. It's good to know that.
Right. I think that's all. Thank you very much, Dr. Rimawan, for the time. Yeah. Yeah. On behalf of IWEEK Organizing Committee, we would like to say thank you for joining us today. Yeah. Okay. Thank you very much. Don't forget, we still have one more sessions. Yeah. Thank you and goodbye.
Thank you. Bye.